All right. So today we're going to be doing a baby bath demonstration, and I have a little girl named Quinn here with me, and I'm just going to start by bathing her. You always start with the face first, and you wash the eyes first of all. One swipe away from the nose, and then you find a clean spot on the face cloth and you go about and wash the other eye. Babies never really seem to enjoy having their faces washed. And that persists for quite a while actually. Because her hair is quite abundant and it's a little bit mucky, I'm going to just pop her right in the tub and we'll wash her hair last. Obviously in every other bath you'd wash the hair right after you wash the face. Now, she's not just too sure how she feels about this, but she's about to realize that it's not the worst thing ever to happen to her. So it's a good practice to always start your bath just putting a nice warm washcloth on your baby and letting her get relaxed in the tub. The water needs to be quite warm, and there should be a fair bit of it because it will cool off quickly, and babies like what they know. Babies come from a warm environment. Amniotic fluid is quite warm, and so if you keep them warm, they usually settle pretty quickly and get comfortable. And one of a baby's first developmental milestones is to learn to establish trust with mom and dad. So if you introduce them to new things gradually and gently, you'll have a baby that learns to establish trust more quickly. Now that she's nice and quiet, we can talk about cord care. The cord doesn't require any special care. You can just wash around it like any body part. The only thing you should do is when you diaper your baby, you keep it outside the diaper and just keep an eye on it for signs of infection. They are redness larger than a toonie around the belly button, fussy drainage, or a foul odor. And they're not subtle. If she gets an infection, believe me, you'll notice. Try not to trim her nails for at least a couple of days. It takes time for the nails to grow out over the end of the fingers, and if you trim them too soon, she can bleed and cry. Yeah. Now I'm going to take this nice warm washcloth off Quinn's tummy and put cooler soap on her. So the next few minutes might get a little noisy, but I'll see if I can't get her settled down before the end of the bath. Hi, baby girl. She's like just looking at me. Okay, she says, I really don't want you to take that nice warm washcloth. Yeah, I know. It's hard. She's beautiful. Hello. Mm-hmm. Okay. And now we go. So, when I look at Quinn, I like everything I see. She's a dark rosy pink color, which is a very healthy sign because babies always get extra red blood cells from their mums at delivery. And healthy babies are also often flexed like a little frog, if you can see that. It's just a sign that she was neurologically mature and ready to be born. So she's a nice, healthy looking little girl. More cold soap, Quinn. I gotta apologize. She's like, I don't like cold soap. That's what I've already figured out in this brief lifetime. I know. It's all right. They actually learn to enjoy their tummy better than their back because it holds the heat in better. And if you don't feel comfortable flipping them over like this, you can just sit her up and wash her back. But I just like to do it because I know they like it. Do you have clothes you want on her? All right. Now we're going to take her out and wash her hair. I know, Missy. Mm-hmm. Now you'll notice I didn't wash all the soap off of her. As long as you're using an infant strength body wash, it's not a big deal. It won't harm her if she gets her hand in her mouth or in her eyes. Okay. Now normally this will be her favorite part of the bath, kind of like when we go to the hairdresser, how we enjoy that water going over our head. But just for today and tomorrow, maybe. Her head's a little tender because the same pressures that were on Mom's birth canal were on her head. So she might have a little bit of an achy head. Hi. You look like you're listening to me. Mm-hmm. It's up to you. So with the initial bath, we like to comb through the hair just because it has little bits of things in it. So, and baby's fontanelles, she has one on the front of her head right here that's diamond shape, and one on the back that's quite hard to find. It's a triangular shape. This one will go, oh, I know. This one will be gone about 18 months, and then the small one at the back will be gone by about 6 months. But they're quite tough. Like, I mean, you wouldn't want to poke at them, but they've got a pretty durable, tough membrane over them. I know. That's a girl. I think she's going to like the hairdresser. Just saying. All right. Hey, little girly. I think there's a little... We'll just use, she's got so much hair, we'll just dry that off really well for her. Most of their crying is usually done when they leave the tub. She might have a little bit of vernix underneath her arms or in her groin, and we're just going to dry the creases well. Oh. It's around her foot. There you go. I know. Oh, I know. She's in a hurry. So when you diaper, you just fold the top flap over. You anchor it on one side, close to the middle, and then you bring the cord out. The cord has no nerve endings in it, so it's easy to move. And like I said, it should be gone by about a week. There you go. She's not sure what she thought of that whole experience. And bear in mind, when your baby cries, they have no idea what an emergency is, so they're just trying to communicate with you. As long as you're attending to them, you're doing what you can do. I know. There, she says, I'm better now. Maybe I won't put the sleeper on her just yet, Ab, just because if you're going to breastfeed her, she should be pretty much skin to skin. I do want to show you how to wrap her and what to do if she's choking or gagging before I give her back. So every baby for the first few days of life is usually a little bit mucousy, and how that'll present is just kind of like they'll look like they're chewing on something. So if you notice them going lip, 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 you may even see them turning a little dusky around the mouth and nose. And you may hear it gurgling in the back of her throat. If you see this while you're here in the hospital, you can certainly call the nurses. But if you're at home, the best way is to tuck her under your arm like a football and just bring her head lower than her heart and pat her back while she's on her side. The head lower than heart is the most important thing, because if she's going to choke on something, her first instinct will be the same as ours, to go, right, suck a big deep breath of air into our lungs. And what that does is just makes it go back down into their tummy. So this just helps gravity get rid of it, okay? And don't panic, they cope with this remarkably well. I think she swallowed it back though, and that's okay too. That will happen. I am going to show you how to wrap her just so you can swaddle her. It's not absolutely necessary, but sometimes you'll find that your baby will settle better if you wrap her up and swaddle her. So you just take a blanket and pretend it's a baseball diamond, and you can put Quinn's head on home plate. She says, I'm glad that ordeal was over. Whoops, I'll take that cord back, Quinn. And then you can just go third base to first base and tuck, second base to home and tuck, and then first base to third and tuck. And almost as soon as you've got her snuggled up there, she's pretty content. She says, never again, lady. Congratulations, you have a beautiful baby.